In this podcast episode, the host interviews Dr. Anna Lembke, a psychiatrist and expert in addiction medicine. The discussion delves into the intricate relationship between dopamine, addiction, and the biopsychosocial factors that influence these phenomena. Dr. Lembke shares her insights from her clinical practice, her book Dopamine Nation, and her experiences with patients struggling with various forms of addiction. The conversation covers a wide range of topics, from the neurobiology of dopamine to the societal implications of addiction, providing a comprehensive understanding of this complex issue. Dr. Lembke emphasizes that addiction is a biopsychosocial disease, meaning it encompasses biological, psychological, and social components. This multifaceted nature of addiction is crucial for understanding why individuals may become addicted to different substances or behaviors. For instance, workaholism is often celebrated in society, leading many to overlook its potential harms. Dr. Lembke points out that the social rewards associated with compulsive work can mask the negative consequences, such as strained relationships and poor health. This highlights the importance of recognizing subtle manifestations of addiction that may not fit traditional definitions. The biopsychosocial model also underscores the need for a holistic approach to treatment. By addressing the biological, psychological, and social factors that contribute to addiction, healthcare providers can develop more effective interventions. Dr. Lembke's clinical practice reflects this understanding as she works to identify the underlying issues that drive her patients' addictive behaviors. This comprehensive perspective allows for a more nuanced approach to recovery, acknowledging that each individual's experience with addiction is unique. Dopamine is a neurotransmitter that plays a critical role in the brain's reward circuitry, influencing pleasure, motivation, and movement. Dr. Lembke explains that dopamine is often referred to as the pleasure chemical, but its function is more complex than that. It serves as a common currency for measuring reward and motivation, acting as the final common pathway for all reinforcing substances and behaviors. This means that regardless of the substance or behavior, the release of dopamine in the brain signals its importance for survival and encourages repetition. The conversation also touches on the role of other neurotransmitters in addiction, such as serotonin and norepinephrine. While dopamine is central to the experience of pleasure, the interplay between these various neurotransmitters contributes to the overall experience of addiction. Understanding this neurobiology is essential for developing effective treatment strategies, as it allows clinicians to target the specific pathways involved in addictive behaviors. Dr. Lembke provides a clinical definition of addiction, which is based on observable patterns of behavior rather than specific diagnostic tests. The 4 C's of addiction: loss of control, compulsive use, cravings, and continued use despite consequences, serve as a framework for identifying addictive behaviors. Additionally, tolerance and withdrawal symptoms further characterize addiction, indicating physiological changes that occur with substance use. This definition highlights the subjective nature of addiction, as individuals may experience it differently based on their unique circumstances. Dr. Lembke acknowledges that diagnosing addiction can be challenging, as it often requires a judgment call from healthcare providers. This subjectivity underscores the importance of understanding the individual's experience and context when assessing addiction. The prefrontal cortex is a critical brain region involved in decision-making, impulse control, and self-regulation. Dr. Lembke explains that this area of the brain acts as a brake on impulsive behaviors, allowing individuals to consider future consequences and exercise delayed gratification. However, individuals with cognitive or attentional disorders, such as ADHD, may have a less developed prefrontal cortex, making them more susceptible to addiction. Interestingly, Dr. Lembke notes that while humans have a larger prefrontal cortex compared to other species, this anatomical difference does not necessarily make us more prone to addiction. Instead, the reward circuitry in the brain is remarkably conserved across species, suggesting that the drive for pleasure and avoidance of pain is a fundamental aspect of survival. This evolutionary perspective helps contextualize the prevalence of addiction in humans and the challenges we face in managing it. Dr. Lembke emphasizes the significant role that social and cultural factors play in addiction. For example, societal norms surrounding workaholism can lead individuals to overlook the potential harms of excessive work. The rewards associated with being a workaholic, such as social validation and financial success, can mask the negative consequences, making it difficult for individuals to recognize their behavior as problematic. This cultural context is essential for understanding addiction, as it shapes individuals' perceptions of their behaviors and the societal acceptance of certain addictions. Dr. Lembke argues that addressing these cultural factors is crucial for effective treatment and prevention strategies. By fostering a more nuanced understanding of addiction within society, we can create an environment that supports healthier behaviors and reduces stigma. Diagnosing addiction is a complex process that relies on phenomenology rather than objective tests. Dr. Lembke explains that the Diagnostic and Statistical Manual of Mental Disorders categorizes addiction based on observable behaviors and patterns. This reliance on subjective assessment can lead to variability in diagnoses among different clinicians, highlighting the need for a comprehensive understanding of each individual's experience. The conversation also touches on the challenges of diagnosing behavioral addictions, such as gambling or internet addiction. These behaviors may not fit neatly into traditional definitions of addiction, making it essential for clinicians to remain open-minded and consider the broader context of the individual's life. By doing so, healthcare providers can better support patients in their recovery journeys. Withdrawal and tolerance are key components of addiction that indicate physiological changes in the body. Dr. Lembke explains that tolerance occurs when individuals require larger amounts of a substance to achieve the same effect, while withdrawal symptoms arise when they reduce or stop using the substance. These phenomena are particularly evident in substances like alcohol, where withdrawal can be life-threatening. Understanding withdrawal and tolerance is crucial for developing effective treatment strategies. For example, individuals with alcohol use disorder may require medical supervision during withdrawal to prevent severe complications. By recognizing the physiological aspects of addiction, healthcare providers can tailor their interventions to meet the specific needs of their patients. Dr. Lembke emphasizes the need for individualized treatment approaches in addiction recovery. Each person's experience with addiction is unique, influenced by a variety of factors, including genetics, environment, and personal history. This complexity necessitates a tailored approach that considers the individual's specific circumstances and needs. In her clinical practice, Dr. Lembke often begins with a dopamine fast or abstinence trial to help patients reset their reward pathways. This intervention allows individuals to experience the benefits of abstaining from their substance of choice, providing valuable insights into their behaviors and motivations. By focusing on the individual's experience, healthcare providers can develop more effective treatment plans that address the root causes of addiction. The conversation explores the rise of behavioral addictions, such as gambling and internet addiction, which have become increasingly prevalent in modern society. Dr. Lembke notes that these addictions often share similar characteristics with substance use disorders, including compulsive behavior and cravings. The accessibility of these behaviors, particularly through technology, has made them more common and challenging to address. Dr. Lembke highlights the importance of recognizing behavioral addictions as legitimate forms of addiction that require appropriate treatment. By understanding the underlying mechanisms that drive these behaviors, healthcare providers can develop targeted interventions that help individuals regain control over their lives. Social media has emerged as a significant factor in the discussion of addiction, particularly among young people. Dr. Lembke explains that the addictive nature of social media is rooted in its ability to provide instant gratification and social validation. This constant stimulation can lead to negative mental health outcomes, including anxiety and depression. The conversation emphasizes the need for parents and educators to address the impact of social media on young people's lives. By fostering open discussions and setting appropriate boundaries, caregivers can help children navigate the challenges of social media while promoting healthier behaviors. Dr. Lembke advocates for a balanced approach that recognizes the potential benefits of social media while also acknowledging its risks. Exercise is often touted as a healthy coping mechanism, and Dr. Lembke discusses its potential benefits in addiction recovery. Engaging in physical activity can stimulate the release of neurotransmitters like dopamine and endorphins, providing a natural source of pleasure and motivation. However, she also cautions that exercise can become addictive for some individuals, leading to unhealthy patterns of behavior. Dr. Lembke encourages individuals in recovery to explore exercise as a positive outlet while remaining mindful of the potential for addiction. By incorporating physical activity into their lives in a balanced way, individuals can harness the benefits of exercise without falling into the trap of compulsive behavior. Dr. Lembke highlights the significance of narrative in the recovery process. Understanding one's personal story and the factors that have shaped their experiences is essential for fostering self-awareness and promoting healing. By encouraging patients to share their narratives, healthcare providers can help individuals gain insight into their behaviors and motivations. This emphasis on narrative also extends to the role of community in recovery. Support groups, such as 12-step programs, provide a space for individuals to share their stories and connect with others who have similar experiences. This sense of belonging and understanding can be a powerful catalyst for change, reinforcing the importance of social support in the recovery journey. The conversation concludes with a reflection on the emotional toll of working in addiction treatment. Dr. Lembke acknowledges the challenges of coping with loss, particularly when patients succumb to their addictions. She emphasizes the importance of staying curious and empathetic, recognizing that each individual's journey is unique. By maintaining a sense of humility and openness, healthcare providers can navigate the complexities of addiction treatment while continuing to support their patients.